Welcome, and thank you for participating in this short video training. In this video, we will learn about the #1 cause of infant deaths and how you as a caregiver can take easy steps to protect infants under your care. In this video, we use the term infant mortality. This means the death of an infant under 1 year of age. We will also focus on sleep-related, sudden, unexplained infant deaths, which is the #1 cause of death of babies 1 month to 1 year of age. We will also discuss some common misconceptions about infant mortality and safe sleep. The first misconception that we'd like to talk about is that infant mortality is not a problem in the boot heel. The boot heel region has an infant mortality rate much higher than both the national and state average. If we look at the data from 2013 to 2019, 100 total babies died over the last 9 years. 47 of those were related to unsafe sleep practices, which means 47% of infant deaths were preventable. Almost half of infant deaths in the boot heel were caused by unsafe sleep practices. One of the most important ways that a caregiver can prevent infant deaths is to practice safe sleep habits. An easy way to remember this is to remember A, B, C. Alone, back, and crib. When we talk about putting baby to sleep alone, it means don't co-sleep, don't put toys, blankets, or any soft bedding in with baby when baby tries to go to sleep. B, for back, means to always put baby to sleep on their back, never on their side or tummy. And C, for crib, means to always lay baby on an appropriate surface, like a crib. Let's take a look at some of the risk factors. Bed sharing increases the risk of suffocation and strangulation. The danger of this situation increases if there is more than one bed sharer, if the adult smokes or has recently had alcohol, or if the baby is covered by a quilt. Another factor is sleep position. You should always place baby on their back every time. This will reduce the risk for choking or suffocation. And it's also important to avoid soft sleeping surfaces and loose bedding. Always use a firm, flat, non-inclined sleep surface to reduce the risk of suffocation or wedging and entrapment. Keep soft objects such as pillows, toys, quilts, blankets, and loose bedding away from the infant's sleep area to reduce the risk of suffocation, entrapment, or wedging, and/or strangulation. Many people may ask, what if I don't have a crib? Are there other safe options? The answer is yes. Listed on the slide, there are several safe options such as bassinets, a travel crib, or pack and play. Always remember to use the guidelines that were in the previous slide. Make sure it's a firm, flat surface that's non-inclined and free of loose bedding or other soft items. This slide shows several ways that a baby's airway can be blocked due to unsafe sleep practices. Another common misconception is that I only need to follow the ABCs of safe sleep if I'm putting the baby down at bedtime. Suffocation and positional asphyxiation can happen in only a few minutes. This is why it's important to use the ABCs of safe sleep every single time you put baby down, even for just a few minutes for a nap. It's also important to make sure that when you put baby down for a nap, you don't use soft spaces such as couches and chairs, or do not allow babies to nap in pumpkin seats, swings, or gliders for an extended period of time. The next common misconception that we'd like to discuss is that if a baby has regurgitation or acid reflux, the baby can choke in the middle of the night if they are laying on their back. This is false, and the following slide will illustrate why. Take a look at the illustration. Notice the position of the esophagus and the trachea. We can see that the infant in the back sleeping position is less likely to choke due to regurgitation or acid reflux. There are some other ways to reduce risk. First is to allow baby to have plenty of supervised tummy time. Always remember to start slowly, only 1 to 2 minutes at any given time, and make sure that it's supervised. Also, you can offer a pacifier at night time, nap time, and bedtime. And also remember, room sharing is good, but do not bed share. Room sharing allows you to easier to feed, comfort, and watch your baby. Here are some safe sleep do's and don'ts. Do place baby on their back every time. Also, dress baby in sleep clothes such as a sleep sack to avoid the use of quilts or blankets. Also, place baby on a firm and flat surface, not a soft surface such as a couch. Some things not to do. Don't use blankets or other loose bedding. Don't lay baby on couches, chairs, or other soft surfaces. And don't co-sleep with baby. Thank you for participating in this short video. Just remember, one of the most important things that you can do to reduce infant mortality is to practice safe sleep habits. These are as easy to remember as A, B, C: alone, back, and crib.